All right. Thank you so much, everybody, for joining. We're gonna give it just a couple of, a minute or two, I think, for folks to hop on. But thank you. Welcome to the first in our Wednesday webinar series. My name is Christina Hagan. I am the State Director for the Campaign for a Family-Friendly Economy, Virginia. We are an organization that advocates for policies that are conducive to economic access for women and families in Virginia. And so I'm very excited to have with us today a great panel and guests here. So without further ado, it looks like we've got a good crowd together here. So again, thank you all for joining us. My name is Christina Hagan. We are excited to have everybody on the line. Just a quick housekeeping announcement. Everyone is muted. If you have questions, you can use the Q&A function at the bottom of the screen to submit those, and we'll get those questions to our panelists as we go. We've got a great lineup today, so we're gonna hop right to it. We're joined by some leading policy experts in the paid leave and healthcare space. Shilpa Phadke is the Vice President of the Women's Initiative at the Center for American Progress. She'll be sharing some updates on what is happening at the federal level, ongoing debate with the next round of COVID relief and what that looks like, and how all of this impacts Virginia families and some of the electoral landscape too. Freddie is a health policy analyst with the Commonwealth Institute for Fiscal Analysis here in Richmond. He'll be talking about some of his research connecting the dots between paid family and medical leave and the path toward racial, economic, and health equity in Virginia. And we have our very own senior advisor, Tara Gibson, here as well. She has been in the trenches in the fight for paid leave in Virginia for the past couple of years, and she will be giving us a quick update on the Virginia landscape as we look ahead to the 2021 legislative session. So exciting times. We're going to kick it off with Shilpa. She does have to hop off at 12:30. So we'll kick it over to Shilpa first, and then take a couple of questions, and then we'll have Freddie and then Tara, and then we'll wrap up hopefully around about 1 o'clock. So Shilpa, over to you.
Thank you so much, Christina, and Freddie and Tara. So great to be with you. I'm really excited to have some time to talk about paid leave, and really want this to be a discussion, and we can jump into questions. So as most of you know, before the pandemic, let's say in January of this year, hundreds of millions of families in America didn't have a single paid sick day or access to paid family medical leave. So that means roughly 32 million folks didn't have access to a sick day. So if you had to take your kid to the doctor, or you yourself were sick with the flu, you had to make that really hard choice between going to work and earning a paycheck. For paid family and medical leave, a little bit, more than just a paid sick day, you had a newborn, or you needed to take care of a sick parent, or you yourself were sick. Only 19% of workers had access. So before the pandemic even started, families were in trouble. And it really depended on your zip code. Where did you live? Did your state have this program? Or what we used to call the boss lottery. Are you lucky enough to work in a place that extends these protections and benefits? And so it really mattered, where you lived dictated your access to being able to care for your family or yourself, as opposed, to what we know is a universal need to care and to give care. So before the pandemic, families were in pretty tough shape. Then the pandemic hit. And we really understood how deeply public health and economic justice were connected. All of a sudden, it mattered if your neighbor couldn't stay home if they were sick, or couldn't stay home and care for someone in a different way than before because of the nature of the COVID virus. So Congress acted. In the spring, Congress passed 2 bills, and we were able to pass the first emergency national paid leave program. After years of work, decades of work by advocates, many of you, we were able to get that over the finish line. And so that gave you 2 weeks of paid sick leave if you needed to quarantine, if you were sick, or you needed to take care of someone, and up to 12 weeks, 10 weeks paid of childcare leave, because as many of us know, schools were closed around the country. So that gave working parents, usually moms, time to stay home and make sure that they could help their kids learn and be there for their families. That law wasn't perfect. It carved out millions of workers. It carved out large employers, some hardship waivers for small employers. The business lobby definitely got in there. So while that wasn't perfect, it was a great start. And it gave roughly 80 million people a lifeline that they did not have before. That includes 50 million children, millions of working mothers. But the program sunsets in just a few weeks. And so that's what we're fighting for right now. How do we really extend the program, this first start, a really meaningful first start, though not perfect, into the new year, especially as the virus rages and continues. We are unfortunately not in a position to be able to pare this back if we care about saving lives. And I think what's really important to me is just connecting that dot between our public health and reopening the economy. We can't reopen safely. The economy can't get past this, and we can't get to the rebuilding mode while we're still in it. And paid sick leave and paid family leave, the ability to be there for your family, is something that we need right now. And so happy to talk more about that and answer questions, but that's the fight of the moment, is getting this program extended past the end of the year, and the clock is ticking.
Thank you, Shilpa. Thank you so much. I remember reading somewhere, and you might be able to point folks in the right direction, but these programs are estimated to have prevented, I think, up to 400 cases per state per week. Is that right?
Yeah, that's exactly right. I mean, paid leave and paid sick days, it pays off in every way you can imagine. It allows people to stay home when they're sick so that they can quarantine, so that, really slow the rate of the virus and of transmission, which is one of the, really critical ways we're going to get this under control.
For sure. For sure. What can Virginians do to ensure that extensions of the COVID paid leave and paid sick programs are included in the federal relief bill?
It's a great question. So just let's go back in time for a little bit. When Congress voted for this and they passed the emergency provisions this spring, it was a bipartisan vote. It passed with 363 votes in the House, 90 votes in the Senate. And then all throughout the summer and towards the election, senators on both sides of the aisle were publicly talking about how great it was. So they wanted the credit. They were proud of what they got. We worked this in a bipartisan way. It is something that voters have always said that they wanted and needed. So it's not, paid leave is not partisan. Paid sick days are not a partisan issue. And so it's really wild right now that we're at this fight, trying to fight to just get it extended. Forget about, carving in all the workers. So the Virginia delegation is critical to this fight. As folks know, your senators are right there negotiating this bipartisan deal, Senators Kaine, Senator Warner. Representative Scott is the chairman of the House Ed and Labor Committee. They are in there and they are critical, and they have been critical voices, but we just need to keep it up. They need to hear from us. They need to hear that this is important, as much as extending unemployment insurance and housing and student loans, everything, state and local aid. They're all critical. And I would just say we need to push back against this austerity mindset that, oh, well, we can't have childcare and paid leave and UI. Of course we can. These are choices. We can choose and we can afford to do it all. And I guess I would just say, remember, when the Senate and President Trump passed that $1 trillion tax bill, it wasn't too expensive then when it was going to corporations and really wealthy folks, right? We could afford it then. But when the impact is on our hardest hit communities, on women and people of color, the talking point is that it's too expensive, and we can't fall for that. We just can't. We really have to push back. Families needs all these things. We are an international outlier. If you look at the rates of COVID spread in all of these other countries, right, America is not leading in a great way. And part of it is because they have a real safety net. And America just doesn't have it. So I would suggest, happy to send more information. You guys have all the best talking points, but to the extent folks can get on the phone like right now and this afternoon, this deal is being finalized in the next few hours. Every little bit helps, and really, really appreciate everyone's efforts.
Thanks for that. It's a great call to action and a reminder that our voices matter in this. And so the more outreach we do to our elected leaders, whether it's the federal delegation over the COVID relief, or as Tara will speak about just in a few moments, our General Assembly members, it's just so critical that folks are hearing from us consistently about the need for paid leave. And a reminder for the folks watching live here, feel free to, if you have any questions for Shilpa, feel free to include them in the chat. I've got one more that I'd like to ask before I know you have to hop off. But my final question for you is about how, as you know, of course, some states already have statewide paid leave programs. Do you have any? Do we know anything about how people were able to use those at the start of the pandemic?
Absolutely. We're really lucky, and there's been such growing momentum to pass these policy in states because the federal government just doesn't seem to be getting it done. In fact, some of you may have seen the voters are just, taking this question directly to the ballot box. In Colorado, for example, many of you might have seen that we passed paid family leave on a state ballot this year. So every day states are gaining momentum, and soon, hopefully, Virginia will be in that box of states that have these policies. But of course, programs in these states help cushion the blow. If you look, there was a great Urban Institute study that looked at Rhode Island and California, two of the oldest paid leave programs. And they showed that workers were able to tap into those benefits sooner. If you look, there's some cool graphs that show claims data. And if you look at the claims for March and then April, as Congress was negotiating, those claims were skyrocketing, in some cases by 40%. Not every state is the same. For example, in Rhode Island, they showed this spike in family caregiving that I thought was really interesting. And that, coincides with the governor there, doing an intense lockdown. But of course, it really gave states additional flexibility, and people were familiar with the programs. They had used it, they love it. I would say the thing about paid leave is, as much as anyone will say we can't afford to do it or it's too much, we have lots of evidence about how this policy has worked. And the sky has not fallen in California or Rhode Island or Massachusetts or all these new states that are coming online. Workers enjoy the benefit, employers enjoy the benefit, and it's really just a win-win. And so to me, the question is, how do we build back better, right? How do we make sure for the next pandemic or the next public health crisis that we have these policies ready to go, so we're not reinventing the wheel and forcing families just to make these incredibly hard choices? One anecdote I will add, and I think it was from a construction site. There was early in the spring, there was a big push to get testing out to workers wherever they were. And there were people out doing free testing. I want to say the anecdote I remember was at a construction site. And they couldn't understand why people didn't want to get tested. It was because they couldn't afford to test positive. They couldn't afford to take the leave. And that's a pretty terrible situation for us, for our workers to have in this country. But we can change it. We can fight right now to get the government to extend the program, and we can fight at the state level to get some meaningful reform passed.
Thank you. That's awesome. We do have a question in the Q&A from Lee Williams about which representatives should we focus on in terms of the, you mentioned Warner, you mentioned Senator Warner and Senator Kaine. What about the House delegation?
All hands on deck. Everyone, of course, leadership and committee chairs play an outsized role in crafting legislation, but every legislator needs to be hearing from you that you care about this, that you want to see it extended, that Congress has to finish the job. So, I would say we're throwing it all at the wall right now. So anyone you can also tweet at them, right? In this virtual world, there's a lot of different opportunities. So I would say call them all. Don't stop.
Thank you, Shilpa. And what I can make sure I'm doing is as a follow-up to this webinar is sending out some talking points and the phone numbers and the Twitter handles and the call to action, as it were. So
yeah, and I would say Rep. Beyer, for example, has been an incredible advocate for these issues, and he sits on the Ways and Means Committee. So Ways and Means and Ed and Labor are the two federal committees that focus on this issue. But everybody needs to be hearing about it. But did want to call out his work. He's been exceptional.
Thank you. Thank you. Thank you. Well, Shilpa, we appreciate your time today. I know you had to shoot off, so feel free to.
Yeah, I can stay on for another 10 minutes and I'm
Okay,
happy to hang out while you guys get started. So
perfect.
thanks again.
Yeah, thank you. I'll kick it over to Freddie Mejia now with the Commonwealth Institute. Excited to hear your thoughts as well.
Yeah, thanks, Christina. And thank you and Campaign for a Friendly Economy, Virginia, for the opportunity to discuss this really important policy that could really benefit workers, millions of workers really across the Commonwealth. I'm going to touch on paid family medical leave, right? Which is what you use when you need a long-term leave, more than 1 or 2 sick days. So my research, really focuses on that policy. Today I want to dig in on how, that policy, a state paid family medical leave policy, would advance racial equity and health equity in Virginia. So I'm gonna throw a fair amount of data at folks, but I want to just give folks a roadmap. The 3 main points I want folks to take away from my remarks are that there are current inequities in paid leave access for low-wage workers. There's economic importance of this policy for low-wage workers and people of color. And finally, there are strong maternal and infant mortality implications, particularly for Black women and families. So just starting off with current inequities for low-wage workers, and Shilpa kind of touched on that just a bit. Nationally, only 16% of private sector employees in the U.S. have access to paid family leave, and only 42% have access to long-term paid medical leave. This is even a larger problem for low-wage workers. So those aren't great, numbers, but when we look at low-wage workers, it's much worse. Nationally, the highest wage workers are over 7 times more likely to have access to paid family leave and 6 times more likely to have access to paid medical leave compared to the lowest wage workers. So across the country, only 4% of the lowest wage workers have access to paid family leave, and only 11% of the lowest wage workers have access to paid medical leave. A lot of people tend to consider the unpaid leave through the federal FMLA, the Family Medical Leave Act, as an option. But there are certain limitations on who gets covered, and certainly unpaid leave is not realistic for many folks in Virginia and across the nation. It's estimated that 55% of Virginia families are unable to take advantage of the unpaid leave entitled by that policy because they do not qualify or cannot afford to take that leave. So that's the majority of Virginians. We know that access to paid leave is crucial for families with low wealth who may not have resources to take extended unpaid time off. Families living paycheck to paycheck are often unable to save consistently and can be set back in their financial goals by car repairs, medical bills, the things that happen in life, right? So preparing to live up to 3 months without income can be really daunting to many of us when we're thinking about our basic costs of rent, transportation, utilities, food. And the current status quo forces many working people to choose between their health and taking care of a loved one or paying for those essentials. And I think a lot of us, we can agree that no one should be forced to make that decision. Simply put, families who are most financially vulnerable do not have many options when it's time to take care of themselves or a loved one. And we can change that. So, I believe we should. Now I'm going to switch gears a little bit and talk about the economic importance for people of color. So state paid family medical leave policy can help more people stay in the workforce. Research finds that people who are Black, Latino, or American Indian tend to have chronic health conditions such as asthma at higher rates and at younger rates compared to their white counterparts. So, this can impact their ability to remain in the workforce if they aren't able to take off the time to address and recover from chronic health concerns. It could become, overwhelming and certainly force people to not work because of their health ailments and not being able to take the time off to address them. We also know that due to historic and present day barriers to wealth and economic mobility, Black and Latino families tend to experience high rates of poverty and are paid less than average, making unpaid leave impractical and just inaccessible. In Virginia, 67% of Latinos and 57% of Black workers are either ineligible or cannot afford to take unpaid leave through FMLA. So if you, just a reminder, we said 55% of folks either aren't eligible or cannot afford to throughout the United States or in Virginia. And 67% of Latinos and 57% of Black workers in Virginia are ineligible or cannot afford to take unpaid leave. So there's clearly a racial equity issue here. We know that this policy is also crucial for Black and Hispanic women who are more likely to be the sole or key breadwinner in their household, making unpaid leave simply out the question. And this is compounded by the fact that women of color are regularly paid, lower wages. And the last point there is, we know that women of color are traditionally relied upon for caregiving duties. People of color are more likely to live in multi-generational households. So that means there's a potential for caregiving for children, parents, and even grandparents. And obviously, this policy is very important for anyone who is in a position to take care of a loved one, especially with the aging population. So that's not to, put down any of that consideration, but the additional factors I mentioned make paid leave especially critical for women of color. And the last piece I want to touch on is a bit of the health equity and piece that you mentioned, and specifically maternal and infant health impact. So we know that a paid family medical leave program could help address unequal maternal health outcomes for Black women. In Virginia, Black women are almost 2 times more likely to die during pregnancy or within 1 year pregnancy compared to their white counterparts. And this is an issue that the nation is facing really. So a state paid family and medical leave program, along with other targeted policies, could help make sure that Black mothers have a equitable opportunity to survive childbirth. Paid leave allows new mothers more time to attend important postpartum health visits, recover from childbirth, and bond with their child. In Virginia, Governor Northam has made it a goal to end racial disparities in maternal health outcomes by 2025. And, we certainly feel that a paid family medical leave program could play a key role in achieving this really important goal. This policy also protects the health of infants, as paid leave programs have been strongly associated with fewer infant deaths. In Virginia, Black families experience infant mortality at twice the rate of white and Latino families. So, the bottom line here is that a statewide paid family medical leave program can give more families of color, particularly Black families, a healthier beginning and future. So just to wrap it up, people of color, wage workers, they just don't have access to paid leave right now. And due to multiple historic and present day factors, people of color have more barriers to accessing paid leave and making unpaid leave just not feasible. So, we certainly recognize that a paid family medical leave program will really bolster so many individuals throughout the Commonwealth, of different ethnicities, of different income levels, but this certainly has, this program and this policy certainly has the opportunity to really make a big impact in terms of health equity, economic equity, and I think that's certainly something that legislators should hear more about. Unfortunately, I think a lot of times when this policy comes up to folks, they automatically think of a woman that's giving birth, or and we know that this is very crucial for new mothers, but this is also a policy for families to take care of their older adults in their household, and we certainly want to make sure that legislators know that so there's so many scenarios where this policy would come into play, and particularly that this policy has a great impact for people of color.
Thank you, Freddie. Yeah, and for sure, I think a really key point for absolutely is that no Virginian should have to choose between seeking the care that they need and drawing down a paycheck. And I think that this makes a huge difference and would make a huge difference to a lot of Virginians. And so I actually see that Tarina Keene has her hand raised. So Tarina, I'm going to go ahead and allow you to speak if you have a question for Freddie. It looks like you are muted. If you want to unmute yourself, you should be able to now. If we're waiting for your mic to connect, I'll just go ahead and ask Freddie. I actually have a question for you. And so, what do you think are the components specifically of paid leave that are most important to ensure that marginalized communities are actually going to benefit from the policy? I mean, obviously, we know that there's a lot of room for good out of this, but what do you think would it take to just make sure that people are aware and people, are benefiting from it?
Yeah. So as I mentioned all the great things that it has the potential to do, right? But I think the biggest hurdle, first off, would be awareness of the program. So if folks don't know that this is an option available, they won't be able to utilize it. And certainly when we're thinking of folks who are signing up on the job, you get a ton of papers the first day, you're signing them all, you've done it through it. You might miss this opportunity, and so the state and other stakeholders will really have an important task at making sure folks know that this is available. And also language accessibility is always a question, so making sure that these documents are available in several languages for different communities in Virginia, right? Another piece, which is a bit of a policy piece, is making sure that low-wage workers have access to a larger portion of their normal wages, right? So this can be achieved by implementing a sliding scale for wage replacement. So, while 80% of normal wages might be just fine for some folks, it's just not feasible for certain, for low-income folks who need more of their paycheck to pay just the essentials, right? So that is certainly a policy consideration that Virginia lawmakers and legislators I feel should definitely consider, and that's something that Oregon that has implemented in their program. And then I think the final thing I will recommend is job protection. So we want to make sure that folks will have a job to come back to, and that they feel comfortable doing that. Obviously, there are amazing, employers out there in Virginia that would, do this in a heartbeat. But we need to make sure that folks are guaranteed their position and won't see any negative retribution for, taking the leave that they are entitled to in order to take care of themselves and their families. So those would be some of the kind of policy ideas and considerations that I think would make the most difference for marginalized communities.
Thank you. Thank you for that. Thank you for your analysis. And in fact, I think in just a moment, I will drop your paper into the chat too, so that folks can read it and learn a little bit more. I'll, again, as folks have questions, feel free to add them to the Q&A box. But in the meantime, Freddie, I hope you'll be able to join us, stick with us just a little bit longer, and we'll kick it over to Tara to talk a little bit about the Virginia landscape specifically. And again, as folks have questions, feel free to flag them. I do actually see some good content here from Susan Burke, which actually I hope that Tara will get to a little bit as well as she continues with Shilpa's call to action, but I can summarize that once, Tara, you've kind of said a few words on your end.
Okay. All right. Sorry, I was trying to read the question. Well, hello, everyone. And thank you for having me be a part of this today. I took a look at some of the folks that are attending. So I see a lot of familiar names, which is really great. particularly those in the reproductive advocacy world. Hello to you. And some Network Nova friends. So just in good company today, and obviously with Christina and Freddie and Shilpa. So what I want to talk about is pivot a little bit to what this all means in relation to the 2021 legislative session. So the latest with paid leave in Virginia is that in this most recent session, there was language written into the budget that assigned both Dr. Megan Healy, Governor Northam's chief workforce advisor, as well as Secretary Brian Ball, to study the implementation of paid family medical leave. So if we were to pass a paid leave bill in Virginia, what would that look like in Virginia? It's a robust study. It's 100 pages. And they did a really great job, I think, of looking at what other states are doing, those who have already passed and implemented this in their state, and tried to glean some lessons learned there. They made some great suggestions and how we could take those lessons learned and apply them here. Some of the things that I can highlight in that study were things like, it should be both, because it's an insurance program, so it should be both an employer and employee contribution, contributing to the insurance fund. And it should live within the Virginia Employment Commission. So, and they also did a really good job on just kind of educating how the program would work and the difference between paid sick leave and paid family and medical leave, which understandably a lot of folks kind of get confused. So just for background, I think, Shilpa and Freddie hit on this a little too, but paid sick leave is your shorter term leave. That's typically 40 hours or 5 days for the year. So that's your kind of cold and flu leave. Paid family and medical leave is up to 12 weeks. So that is for your bigger life events. So that's a serious health issue of your own or a family member, you're welcoming a new child into the home. So one is short-term, one is long-term. I'm pleased to share that this coming session in 2021 will have Senator Jennifer Boysko introducing on the Senate side, and then Delegate Hala Ayala will be our patron in the House. So this is where we're going to need all of you. I think the thing that is, really important to seeing this pass here in Virginia is creating that demand and continuing to kind of, create that drumbeat of demand. So many of the legislators that you know and love are supportive, but some are still on the fence. And regardless of where they stand, they still need to hear from you all so that they know, like, this is important and this should be a priority in their fight, as they go into another session. So I will drop a link, or Christina can drop a link in the chat as a way you can contact your legislator, both Senator and House members today, to say that you would like to see paid leave going. And then I will just reiterate what Shilpa said, and also contacting your federal legislators, as that is more urgent, obviously, because those conversations are happening as we speak, to see paid leave included in the next round of COVID relief. So I will stop there.
So what's the path from here? So what's going to happen? What should we expect during session?
So, I think session's going to be, virtual. It's going to be a little weird as it continues, as we saw in special session. So we'll see the Delegate Hala Ayala introduce her bill in the House. My guess is that it goes to House Labor and Commerce first, as we saw it go there last year. And then the next stop would be Appropriations. On the Senate side, it will go maybe to finance or commerce and labor first. This 2020, it went to finance first. So it will be, it's usually in the money committees and the commerce and labor committees on both the House and the Senate.
So also in the follow-up, we can share which members that means, because again, you know, as we have to get the bill out of committee before we can get it to the floor. And so you got to start there. And so yeah, no, we're really excited about getting something through. Hopefully in the 2021 session, and either way, we do expect that you know, paid leave will be part of the kind of care economy package as we look ahead to the 2021 election cycle. And in fact, I know we've got some exciting polling to talk about. Tara, do you want to talk a little bit about that?
Yeah, absolutely. So helping family caregivers is not just good policy, as we have talked about over and over and over again today. I think for those of us in Virginia who have elections every year, it's important to know that it's also good politics. So the Women Effect Action Fund released some new polling right after the election that shows that there's a rising class of what they call care economy voters. And those, including those that have been battered by COVID-19 and that are facing some, you know, personal and financial strains. So they're focused on the need for childcare, elder care, family and medical leave, paid sick days to stay in the workforce and care for loved ones. Millions of these care economy voters played a decisive role in the 2020 election. So they were critical to the coalition that elected Joe Biden and Kamala Harris. And they are driving suburban victories that help them, these candidates, flip states that Donald Trump won in 2016. So these care economy voters, so this is what the poll found, supported Joe Biden 61% to 37% over Trump in these battleground states. Several of which, as I'm sure many of you know, that Biden won narrowly. The improved margin among these care economy voters was clearly a decisive factor in Biden's string of narrow victories. On a state level, we also saw in 2020 that in Colorado, there was a referendum for paid family and medical leave with a similar structure to what we're proposing here. Not only did it pass, but it outperformed both President-elect Biden and Senator-elect Hickenlooper. So this is something that we should definitely encourage folks to run on and talk about, because it is an issue that they can win on.
For sure, and I think that's a critical piece, is that this is something that I think a lot of the time the kind of campaign managers and so forth are trying to figure out how to mobilize the base and how to persuade some of those pesky undecided voters, and oftentimes it's different messages that you're looking at. Whereas what I think this polling data shows, and frankly a lot of the research that we've seen shows, is that not only is this a great issue for mobilizing our base, but it's also a great issue for winning some of those middle of the road voters. Because at the end of the day, again, I just think in a very, very real way, this pandemic has demonstrated some of the long-standing economic challenges that families face, and it's not unique to the pandemic. The pandemic has exposed it in a very real way, but I think there's more and more understanding of frankly the need for programs like this. And to Tara's point, you know, the fact that the Colorado referendum outperformed the Democratic ticket shows that there is some cross-party appeal here. And to what Shilpa was talking about earlier, the fact that we got a COVID relief package through a Republican-controlled Senate, which included, you know, paid leave and paid sick program, emergency paid leave and paid sick programs, is frankly very significant, and again shows that these are common sense policies and programs that that Virginia workers and families need and deserve during the current crisis, but beyond that as well. And so, you know, what Susan Burke wrote in the chat to the panelists here had to do with some of the great advocacy that the American Association of University Women is doing. It sounds like they just sent out an action alert earlier today about specifically urging members to contact members of Congress to urge support for comprehensive relief before the end of the year. So I'm really glad to hear that. You can see it's a broad coalition that we're a part of as we kind of go about this advocacy. She also talked a little bit about the gender pay gap as an additional kind of issue. And so I know that is definitely another area that's been a huge priority for Senator Boysko as well, who of course is our Senate patron for paid leave too. But absolutely, I mean, it's all part of, again, leveling that playing field for women who in many cases are, certainly single moms supporting families, but more broadly speaking, women are just kind of falling out of the workforce in at much higher rates than men in the current climate. So, and that sets women back again on salary and pay when they do eventually rejoin the workforce. And so it's a spiral at that point. It's an ongoing problem. So she also had a question here about the relationship between our push for paid leave and the Coalition for Paid Sick, which is being led by the Virginia Interfaith Center for Public Policy. And so I might kick it over to Freddie and or Tara. I know while we are definitely very eager to see paid sick adopted, you all might be a little bit better at speaking to it than I am. So I'll kick it up, maybe Tara in the first instance to talk about the coalition, and then Freddie maybe to just give an overview of where the paid sick process is at this point.
So I think to answer Susan's first question, yes, we do work with that coalition. There's constant communication there, and there always has been. I think that it's important when you think about sick leave and paid family and medical leave, just to remember that one does not exclude the other and that both are important and both are needed. And if you look at states that have one, they typically have the other. So one really, it almost is like one passes the baton to the other. So where one stops, the other one kind of picks it up. So the way that we are working together, one of the ways is that this is the message that we carry when we talk particularly to legislators, as we're lobbying for these issues.
Yeah, and I guess I'll just give a little bit of history on paid sick. So this was a bill that would allow, would mandate essentially that workers across the Commonwealth will be able to earn paid sick days, and so that's those 1 or 2 days for your cold or for your flu. So that bill died in the final days of the 2020 session, right as we were starting to get into the pandemic. It was introduced once again in the special session, and unfortunately did not succeed at that point. But it's certainly a great need here in Virginia. Only a third of workers at service industry employers in Virginia have access to paid sick leave. So that's just a day or two to take off. So it's certainly an important issue. As Tara brings up, I think that these policies should be seen as two policies that could work in tandem in order to really support workers in Virginia. I do know that the bill was introduced by Senator Favola, and the House version was introduced by Delegate Elizabeth Guzman. So I can't speak with a certainty around whether those two patrons will be introducing it this coming year, but I would imagine we would see it this coming year, and certainly TCI is supportive of both both coalitions that we see as really vital to supporting workers here in Virginia.
That's absolutely right. Yep. And we definitely, like, as Tara pointed out as well, these are two policies and programs that need to run concurrently. And so we are extremely supportive of both. Many of our partners within the Paid Sick Coalition are also part of our Paid Leave Coalition. So there's a lot of overlap. And so we're excited for some good movements, hopefully, in the 2021 legislative session. So we have a question from Krista Miller in the chat here, just about the recording. We will be making it available as soon as we wrap up. We have a question about what is covered in basic needs. So I don't know if that's a little bit more of a Freddie question.
I guess I'm not sure what you mean in terms of basic need, what's covered in basic needs. So I guess I look for some clarification. I might have missed it while I was talking, so apologies.
No, that's okay. No worries. I think, again, my interpretation would be just about kind of, again, that kind of breakdown. What do you use paid sick for? What do you use paid leave for? Maybe.
Gotcha. Okay. So paid sick day would be, you earn hourly time off as you work, or you get a certain amount up front, depending on the legislation and how it's built out. But then you'd be able to take, Tuesday, Wednesday off, and then you'd be expected to come back or take as much time as you have, right, accrued. Whereas the paid family medical leave program would be a bit more of a official process. You would, apply for it, right, through the new body that would be created, and you would have up to 12 weeks off to take care of a serious medical condition, to take care of welcoming a new family member, whether that be through birth or through adoption. Certainly have seen some, for folks who are military families, if folks are leaving, deploying, they would be eligible to have some time off to see them off. So it's a much more long-term process, and it comes with a different wage replacement as well. So paid leave, paid sick days, you get your regular time from the legislation I've seen. The paid family medical leave, since it's such it's a longer term policy, you'd get a portion of your income back, and there's also a fund from the state. So it's not coming from the employer, right? The employer and the employee, they pay equal amounts into the state fund. The state fund would give money back to the employee. So a couple of differences there. I think I went a little bit in a couple of different ways, but certainly different policies that could really work in tandem to help folks. I don't know if I missed anything, Tara, or misspoke.
No, you got it. You got it. It's really time. The big differences are time, the funding structure. So one is provided 100% through the employer, which is paid sick. Paid leave, again, is an insurance program where everyone's got skin in the game with both employer and employee contributions.
Great. I think we're caught up on questions. I don't know if there are any that I'm missing here in the chat, but I do see a comment from Lee Williams just saying that Delegate Guzman is carrying paid sick again in 2021. So again, I think we'll have some good movement on on these issues. So exciting times. So we are a little bit ahead of schedule, which is rare, but with all that being said, I just wanted to just take a quick minute to, again, a huge thank you to Shilpa, Freddie, and Tara for sharing your expertise with us today. I know I learned a lot as always, and so thank you so much for all that you do. Just a small plug, we do have 2 more exciting panels coming up in our Webinar Wednesday series. The next one is going to be next Wednesday, December 23rd. And so we'll have some special guests kind of from our advisory board. Actually, we have Mike Hamler, who's a small business owner out in Roanoke, and Katie Crystal, who is a member of the Arlington County Board, joining us, plus a couple of possibly a couple more folks too. So it should be a really great, vibrant conversation again about what their experiences are from different parts of the state, and what this could mean in those communities. And then in our first session in 2021, that first Wednesday, we'll hear directly from the patrons about the bill and about their hopes and how they came to be interested in the issue and to want to carry the bill and be champions for paid leave in Virginia. So then in the meantime, I hope you'll also consider signing up for our special 2021 action alert list. And so this is where we'll be sharing key updates through the legislative session and beyond into the campaign cycle. There's going to be a lot going on throughout 2021, busy year here in Virginia. And so lots of opportunities for engagement and staying involved. I would like to echo what Shilpa and Tara were saying earlier. Please call Senator Warner, Senator Kane, call, I know we've got a bit of a geographical spread here, so call your representative in Congress. They all need to hear from you. They all need to hear from all of us as we look ahead to the bill, the COVID relief package that's being finalized here in the next few hours. And so I'll just send a quick email out about that as soon as we close out here. And also, please call your state legislators, state House, state Senate, as we gear up for 2021 General Assembly session. Even, we've got, like Tara was saying, we have supportive members, we have members who are still a little on the fence, but ultimately they all need to hear from folks, because they all need to know that there is demand at the grassroots level, and that their constituents not only want to see paid family and medical leave established, but it's a major priority for their constituents as well. And so keep that drumbeat going. Thank you all for participating in our webinar this afternoon. Thanks again to the panelists, and we'll see you next Wednesday.
Thanks, everyone.
Bye, everybody. Thank you.